I think the C is more appropriate. All right, now let's deal with psychotic patient quickly. We said that the non-psychotic patients, they don't have insight. They are not reality-based. They don't know what's wrong. Oh, the non-psychotic ones, rather, they know what is wrong with them. Okay. They are reality-based. They have insight. They are not psychotic. But the psychotic ones, they lack insight. They are not reality-based. They don't know what is going on. They see things differently from what others see. I'm going to teach you some 3 methods that you can take along. I know your teachers might have taught you something, but this is from my clinic, and I think it's very laudable as far as the NCLEX is concerned. Now, this, for all you know, is just going to shape how you reason. Okay, no one will ask you direct questions on this, but it will shape how you reason and think of how you answer a question. The very first one that I'm talking about will be functional psychosis. That one is wow, bottom. The patient is crazy, and there is nothing you can do about it. Excuse my language for that. We can try to sugarcoat words like mentally challenged, but this is really a lunatic, somebody who is purely having trouble. This is probably because maybe he was with a boyfriend or so, and the boyfriend just left him, and the thing, I mean, something just strange happened, and that's all to it. She's never had an insight or she's not reality based anymore. So that one is the functional psychosis. That one is when you go and take a substance, when you want to be with the most high God. And so you decide to take in smoke to build clouds for yourself so that you can live in them. And then the Bible will describe you as having a face of clouds. Then you can start with maybe Indian hemp, or how do you call it in your local area? How do you call it in your local area?
Igbo.
Igbo. It don't they smoke Igbo? In Tamfe. We. Over here, some people actually call it weed. They add the D to it. In Habain. Somebody was even called a herbalist. I thought he could cure illnesses, but my perception was wrong because of how he could combine some leaves. There was a driver who once upon a time went on a program with us. It was a military wedding ceremony that we attended in Kumasi. And then when we were about returning, the driver had promised the mom that he will be bringing a military vehicle to Kumasi, and so he will pick her alongside because the mom wanted to come to Accra. So this guy went to pick the mom. We didn't even move, let's say, 15 minutes. Then he decided we should pass through the closest military barracks so that he could have some rest. In fact, that rest, it took us about 5 more hours before he could wake up. Apparently, he had taken some coke. It was actually in a coke bottle. And then he requested the boys pour. Later, we got to know they say it's called Ujomi or something. I don't know if any of you have heard of it before, Ujomi. And if you listen to the driver's account, it looks like when he looks at a building, he could mention the names of the people building it, and he could give you with precision the year it was built. That substance he took in. Sandy, Enovizo, Ojomi. I don't know what they use in preparing those materials, but the guy could say with accuracy when a building was built. Okay. All right. Dementia. Those that the dementia I'm using here, I'm using it as a colloquial language. Those days, when a spirit came upon somebody, they would say the person was demented. Like in the religious text, like in the Bible, when Paul had some brief illness, they would say he was being tormented by a spirit. And when you look at the Greek word, it's the same word for dementia. So dementia in this regard is just a neurodegenerative disorder. When we say generative means something that can come up, something that can come into existence, something that can sprang out, generate, bring it up, bring it on, make it alive, create it. But degenerate means it cannot come alive. It cannot regenerate itself. So liver cells, for example, when your liver cells are having troubles, they can regenerate themselves. The cells